right, let's take a look at tissue integrity. Now, when we look at tissue integrity, it's important for you to remember what tissues are. Tissues are a group of cells that are working together for a common function. Remember that in the human body, there are 4 types of tissue. There's epithelial tissue, connective tissue, muscle tissue, and nervous tissue. Now, when we talk about tissue integrity, this is a structurally intact and functioning tissue, and most often it's talking about the epithelial tissues, specifically the integument, which is the skin, and the mucous membranes. Because guys, if those are damaged and their integrity is under stress, this could lead to potential infections and other issues with the body. So when we look at this integument or the skin, remember the skin is composed of the epidermis, which is the upper layer of the skin, the dermis, which is the thickest layer that we see there, and then the subcutaneous layer is below the dermis. It is the connection, it's kind of the basement of the connection between the skin itself and what we're looking at with the underlining tissues, whether it's muscle or bone. Now, the epithelial tissue, guys, is that topmost layer, but we do see that sometimes when we're looking at tissue integrity, the dermis is going to be affected, which is also connective tissue, not epithelial tissue. Now, remember that your skin has several protective type functions. For one, it's to help protect you against mechanical trauma. Okay, so it's your first line of defense there, so it's protecting underlining areas from mechanical trauma. Your skin also prevents you from losing fluid. Okay, you do sweat and lose some fluid that way, but that's controlled by your skin and the glands that are located within there. Okay, it doesn't just allow you to seep fluid out. We also see chemical disruption can take place. If the skin is not present, this is where you end up seeing a fluid shift and electrolytes tend to leave. That's also in sweat. That's why your sweat tastes salty. And then also infectious organisms can gain access if the skin has been compromised. And so again, the skin's to protect you from foreign invaders. It's one of your first lines of defense that we talked about back in the immunity. So guys, when we look at variations of tissue integrity, there are 6 different ways that the tissues integrity and functionality could be affected. So we see the first, of course, is trauma or injury. This could be as simple as an abrasion, like even just a carpet burn, not even a deep one, just where the top layers are taken off. That's a very mild case, but then it could also be a very deep wound where we get down to where muscle and bone may be exposed. We also see that when we talk about trauma or injury, when we look at tissue integrity, they could be intentional. And this is like when we have incisions during surgery. We are intentionally cutting through that tissue, ultimately compromising its integrity in order to gain access into the body. The next one is loss of perfusion. Loss of perfusion is decreased blood flow to an area. This is going to decrease oxygen and nutrient supply to that particular tissue. This is going to create a lot of times what we call ulcers. It's going to cause an ulceration to take place, and a lot of times we call them bed sores as well, because individuals who are bedridden tend to develop them due to the pressure of them laying on those particular areas on the skin. We also see immunological reactions. These are going to be like redness, rashes, and even hives that may develop. It's normally an allergic type of reaction. We also see there's some genetic components that, like things like psoriasis, where we see it's an immunological reaction on the skin and it manifests as like a scaly type of structure. Infections and infestations can also cause issues with the integrity of the skin. These are, of course, could be bacterial, viral, fungal type infections, which were talked about back in the infections video. It could also be infestations due to like lice or scabies, like bed bugs, could also potentially cause problems. Thermal or radiation injury, these include burns. Burns can be as mild as some sunburns, where you just have a kind of reddening of the skin. They could also be very severe burns, where we get to what we call 4th degree burns. We also see that there could be radiation burns or injuries that can occur as well. And then we have lesions. Lesions, guys, are going to be where the skin growth is not the way it should be. When we look at lesions, a lot of times we think of moles that have mutated and are more cancerous. These lesions could be benign, where they don't spread from one space to another, or they could be malignant, which we would consider cancerous. Now, what are some consequences when the tissue integrity, especially of the skin or mucous membranes, is compromised? Well, we see that the patient will have an issue with thermoregulation. They'll have a hard time regulating their body temperatures due to the fact that they do not have that outer layer that's protecting them. We also see elimination could be affected. We see that certain waste is going to be removed from your body in certain ways. So we see that breathing out removes gaseous waste. Your digestive system helps with solid waste. Your skin and your urinary system helps with liquid waste. And so this elimination of waste could be affected. Fluid and electrolyte balance could also be affected. This is where we could see a fluid shift take place and fluid starts leaking out of that compromised area where it shouldn't. This happens when we talk about like wounds weeping, where they have this kind of weepiness where fluid is kind of coming out. It's not pus or blood, it's just kind of a fluid. That could affect the fluid and electrolyte balance. We also see it could cause issues with that protection from infection. We get sometimes those secondary or opportunistic infections that come into place when the skin or mucous membranes are compromised. Also, safety. Some consequences that we see are going to be safety issues when we deal with that skin not being there like it should. Comfort and pain, right? For things to be comfortable, we don't want pain to be present. And so when we are missing certain areas or nerve endings are exposed due to the top layers of skin missing, this can cause the patient to have more pain, which then can make them uncomfortable. And then body image. Sometimes when we have issues with body image, it could be due to the skin having to be replaced with skin grafting, and that skin grafting not looking as normal as the normal skin did. And so it could affect some of that body image idea in their brain, and it could cause them to have some psychological issues with that. All right, so what are some risk factors when we talk about skin integrity? Well, age is part of this. We see that the very young, their skin is going to be pretty thin. We also see that they do not have the ability to sweat like we see in older children and as we age. We also see as we get really old, the skin starts to thin again. The subcutaneous layer is also not as thick, and so it can break a lot easier. Individual risk factors can be big here with the skin. Some general health issues can be part of this. We need to make sure that we try to keep, again, a healthy lifestyle as much as possible. If you're obese and the skin gets stretched, it could obviously compromise it a little more often. There are some different genetic issues when it comes to the skin. Some of these things could be like albinism. Albinism obviously affects the pigmentation of the skin, and that offers you protection from the sun, so you wouldn't have that if you have that particular genetic disorder. So genetics can also play a role. Skin cancer. We want to reduce that risk of skin cancer. However, there again are some genetic components that make you more prone. The fact that your skin may be lighter, if you have lighter hair, all of that where you don't have the natural components to help protect you from the sun. It could increase your risk of skin cancer, or increase your risk of mutations, getting sunburns, and increase the risk of skin cancer. Also, pressure injuries. When we talk about pressure injuries, these are going to be the whole idea of shear or friction injuries that occur. This needs to be where we move individuals, if they are bedridden, correctly in their bed, turning them on a schedule, but also turning them properly. Not pulling them up against the sheet, because that can shear their skin, because friction, when two things rub across each other. We want to make sure we use pull sheets, and we also use more individuals if need be to help protect the patient's skin integrity. Let's look at assessment real quick. When we want to assess an issue with the tissue integrity, we're of course going to take a medical history, as well as we could take some of their social history. That might be an indication if they like to sunbathe or they do tanning beds, that kind of social interaction of what they do outside of the medical side of their history could ultimately affect them. We want to do an inspection of the skin. This inspection is going to look for any abnormal areas, discolorations, moles, things like that. We also can do palpation. The skin should feel a certain way when we palpate it. We should not have it where it's like super stretched out or have lots of edema and things like that. We also then can look if there are any wounds, and if there are wounds, we want to take note of the size of the wound, the color that's present, The cleanliness, is the wound clean, or does it have pus or debris inside of it, like dirt or foreign objects? Does it have a particular odor to it? Is there a presence of drainage or exudate? Okay, so when we talk about that, is there a scab over it? Is there drainage in the form of pus? Is there something going on that's kind of almost leaking out of the wound? And then also, are there wound drains present? Some wounds, especially when we talk about abdominal wounds, they need to be left open so they heal from the inside out. Okay, if that occurs, or if an individual has had an infection before and we need the wound to be able to clear that infection and then repair from the inside out, a wound drain may be present to help with that, draining off that exudate or fluid that's there, but also allowing to help keep the wound open. The last thing we see there is staging of ulcers. Ulcers, of course, are going to be due to pressure. That's like bed sores, and there's different stages based on how much the skin is broken down, and we'll talk a little more about that in a second. So let's look at some of these cutaneous traumas, or issues that happen to the skin itself. So this could be simply like an abrasion, like you see over here in this picture. We could end up having blisters. You can see the fluid there is like a clear serous type fluid. We don't have, this is a clear kind of interstitial fluid. It doesn't have blood. We could see that it's more of a gaping type wound where we are missing actual tissue. It could just be a simple laceration like we see here on the leg, or it could be even a bruise. That bruise is obviously showing you that underneath there was tissue the tissue was compromised underneath that skin layer. All right, so these are some of those cutaneous traumas that we might see. All right, well, what about burns? Burns are a little bit more severe in some cases. When we look at burns, they can be marked as either first-degree burns, like you see here with the sunburn. This is just a simple sunburn. It heals in a couple of days, but we do see side effects of where you tend to get chills or have issues with the touch because the skin has been injured. However, there are times whenever a burn gets more severe, and this is a second-degree burn, and a second-degree burn is characterized by having a blister with it. A lot of times, if you can get a second-degree sunburn if you develop water blisters, especially on your shoulders from the burn. That told you that that area is burned worse, and it's actually a second-degree burn, which means it did not affect just the epidermal layer. It goes deeper into that dermis. This one takes a little longer to heal. We also then see that you can have a second degree burn that is going to be deeper, or what we would consider more of a third degree burn. These are going to have these two areas here that you can see where we have a pinkness where the skin's actually removed. It could even go deeper where you may see even some of the subcutaneous tissue. That's that kind of yellow tissue that you see here. Those are going to be deeper burns. Those are still going to be very painful. When you look at this, the nerve endings have not been necessarily completely destroyed, and so because of that, they are also very painful burns. The last one you see here on this hand, this is a very severe burn because you can see all the way down to the bone. If the muscle, bones, or tendons are exposed, that's what we consider a fourth degree burn, and that means that you've taken away all the layers of skin. If you get to the subcutaneous layer, or even deeper underneath that subcutaneous layer, you have taken away all the layers of skin there. Those types of burns are going to have to be healed using skin grafts because we do not have the tissue in order to cover where the damage has occurred. Okay, because we've taken out those base layers of the epidermis and it cannot heal on its own. Now guys, with burns, there's a lot of complications that can happen with burns. When we look at burns, if their body is burned in multiple areas and they're pretty severe, second, third, fourth degree burns, you're going to look at fluid shifts happening. Patient can get dehydrated very quickly. Those burns will weep a lot and a lot of fluid will be lost. They also cannot regulate their temperatures because of this, and they are very prone to getting infections because we've burned that layer off, that protective layer. And so it's really important when we talk about burn units that we protect those patients against potential infections, if at all possible. Now, also when we do wound dressing on burns, we need to be careful that they don't stick. Okay, we'll talk a little bit more about the types of dressings a little later when we put them on certain wounds, but we want to make sure that they don't stick and then they mess up the tissue integrity when you try to pull them off. We want to make sure that they aren't sticking, and so there's certain different dressings that can be used for that. The next one we want to look at is the pressure ulcers. Pressure ulcers can be graded from 1 to 4. So in this first picture here, you can see this is a stage 1 pressure ulcer, and it's just showing redness over the area where the pressure was present. So this might be on the hip or the coccyx or on the heel or the ankle, but where a lot of times there's a bone that's putting pressure on an area of thinner skin tissue, there will be more chances of an ulcer of developing. Now, when we look at a stage 2 ulcer, this is going to be where the dermis is now exposed. The epidermis has been hindered, it's been taken off, and the dermis is now showing. In the third stage 3, we see that we have a full thickness, and we can see that there is a very kind of gaping crater-like structure that is present. Hey, that would be what we would consider a stage 3. And then stage 4 is kind of a full thickness in this sense. It goes all the way through all layers of the skin. We may have exposed muscle and bone like you see here. And so this one again is going to be a little harder to close up because it's so deep. Okay, so these are those ideas of pressure ulcers. Guys, a lot of this could be prevented by moving the patient properly, keeping the area of the skin clean, trying to avoid that breakdown at all possible. Sometimes they're not avoidable, but we don't want to see them get to that stage 4 if at all possible, because the healing process is greatly hindered at that point. So some diagnostic tests when we talk about skin integrity, we could do some allergy testing. This is going to let us know if they have allergic reactions, and we want to stay away from certain things that can cause itching to occur. We may need to do wound cultures. If there's a wound present, we want to check for infection because it could help us determine what kind of medications to utilize and what kind of dressings we may need to use. Tissue biopsies may be needed, especially when we're talking about skin cancer. We're talking about certain lesions, and we want to do a biopsy to find out what kind of skin cancer it is. Certain skin cancers are more prevalent, whereas others are more deadly, and so we'd want to be able to identify those and treat them properly. And then they may also use Woods lamps. This is a special type of lamp, and it's actually kind of a black light. And what they use this for is to look for certain kinds of infections. All right, so it's a special light that they can use to look for certain infections. Again, when we talk about primary treatment, this is the preventative side. This is going to be where we want to try to get them to have proper skin hygiene, keeping their skin clean, hand washing, making sure they have proper hygiene in the sense of bathing, that sort of thing. Maybe also using ointments and lotions to help so that the skin doesn't start to break down. Nutrition is also really important here. Having proper nutrition helps keep your skin healthier. Sun exposure, we want to limit sun exposure and also talk about correct sun exposure with the use of sunscreen. Burn prevention, okay, teaching about burn prevention of like staying away from hot water, not touching hot objects, that sort of thing. Prevent the breakdown of the skin through ulcers, again, by turning patients, keeping them as mobile as possible could also help with this. When we talk about secondary, the screening part, this is going to be mostly when you inspect areas of the skin that are abnormal, like a mole or a pigmented area that's changed. We want to look at things like the symmetry. Has the mole changed in its shape? Is it asymmetrical in the sense that one side is larger than the other? The borders, are the borders irregular to that particular lesion on the skin? The color, has the color changed recently? Has it gotten darker? We also see the diameter, is it growing? And the last is evolving. And evolving just means, is it changing? It could change in its diameter, it could change in its color, it could change in its borders. In other words, you're just determining if there's a change that's taking place. So this is that idea of screening for skin cancer. On the other hand, when the integrity of the tissue has been affected, what can we do to help maybe get it back more to normal? We could see that there could be certain drugs that could be utilized. These are going to be things like antibiotics if we have a bacterial infection. It could also be steroids to help with inflammation in an area, or even allergic reactions. We also see certain lotions or creams might be utilized to help prevent that breakdown. And then also chemotherapy drugs if we're talking about skin cancer. Surgical intervention. Oh, the next one is phototherapy. And you're like, well, wait a minute. We just talked about in the primary that we want to keep people away from sun exposure and that sort of thing. Well, there is kind of a happy medium. You do need some sun exposure to help you with your vitamin D and that sort of thing, but we also need some sun exposure if you've got certain genetic issues with your skin like psoriasis or even eczema. There's a certain window of amount of time that actually can help if you're exposed to light in a good way, and it's also controlled. It's not where you're just going out for hours at a time and burning your skin as well. Surgical interventions can include things like excisions, where we may want to cut out certain areas if the skin or tissue that is causing a problem. We could also do debridement if the wound is not clean and we need to get the necrotic tissue out, or even foreign bodies like gravel or things out of that. We would want to do debridement to remove that. And then skin grafting may also need to be done in some cases, especially with certain types of burns or if large areas of tissues have been lost. Wound care. This is a big thing. Wound care is done normally either by nurses or physical therapists, depending on the facility that you're at. Wound care is really important because this is to help keep the wound clean. The wound needs to stay cleaned in order for it to heal properly. We may also see that irrigation may be needed. We may need to use different types of solutions like saline or things like that to help clean the wound out. We need to be careful about using certain things like alcohol or even hydrogen peroxide, because those can end up hurting good cells as well. Dressings are really important. Different dressings may be utilized in different situations. Sometimes a dressing may be where there's packing in the wound first and then they put a cover on it. We might want to use, if there's lots of exudate that comes out of the wound, we want to have a lot of gauze in order to help absorb that. In other cases, we may want a non-stick type bandage because we don't want it to stick to whatever skin is trying to grow back to the area. But there's a lot of different types of dressings that are out there, and you would of course learn which ones are needed in certain situations, again with experience. Nutritional support also is very important because healing requires lots of calories. Making sure the proper nutrition of the patient is important to help with that healing process. All right, so this just takes a little bit of a closer look at tissue integrity, but what if the wound is already there? We talked a little bit about the fact that wound care may be needed, but there are different types of wound healing that we want to talk about real briefly. One is called primary intention. Primary intention is where the margins of the wound are very close together, and so a lot of times we can just suture it up. This is what happens when we do a surgery for the most part. As long as we're not removing large amounts of tissues, we can close up and close that with a suture or staples, or even in some cases with lacerations that come in with glue. Okay, these are primary intention. In a secondary intention, the wound is more open, it's gaping like you can see here. We can't just close that up because then it leaves a cavity in order for maybe more bacteria to grow and more issues to happen. So we want this wound to heal from the bottom up. And this is where wound dressing and wound care would be important, because we would want to fill that in and let it heal from the bottom up. We don't want the skin to just cover the top. Now, a tertiary intention is a little different. It's very similar to the secondary, but this is where a wound may be left open on purpose. It will be left open on purpose because an infection was already present and we want to make sure that it gets cleaned out. So this is a wound that would be left open on purpose. Sometimes they'll use a special type of vacuum type of wound dressing that would help with this, to help pull out extra fluid and exudate that it does, but it helps also keep it open so it does not heal too quickly. Now, when we look at wound healing, there's 3 stages that occur. There's an inflammatory phase that lasts for about 3 to 5 days. This starts the healing process. It brings in reinforcements like clotting factors and white blood cells and different things that are needed in order for healing to begin and take place. This then goes on to the granulation phase. The granulation phase is where new vessels come in. These new vessels are going to help bring in new collagen fibers, give support to those cells in order for them to replicate, and it allows for new buds of tissue to start forming. A lot of times, guys, this tissue is going to look like little buds on the surface. Now, we need to be careful when we clean wounds like that, because you don't want to rub them, because this would take away all the new growth. This is where a lot of times a padding may need to come in order to make sure that you don't remove all of that really new delicate tissue that's forming. The last stage is the maturation phase. The maturation phase is the remodeling phase. This is where it's going to remodel the tissue that's laid down. And this is also going to cause what we call scar retraction to take place in order for us to get that ultimate healing as much as possible, where the scar is not too large to where it potentially hinders the function of that particular area. Because guys, scar tissue does not act exactly like the original tissue. And so this last part is just to try to get it back to as much normal as possible. All right, so that finishes up looking at tissue integrity. If you have any questions, please let me know.